If you wish to be a neurosurgeon, understand first what this profession will eventually demand of you. One day it will ask you to hold a living human brain beneath your fingertips, while a person's entire identity, their memories, their humor, their ability to recognize their own children, sits exposed and completely vulnerable before you. But your journey doesn't start in an operating room. It begins at 16 years old, sitting in a cold hospital waiting room while a relative undergoes emergency surgery. You watch a surgeon walk out toward your family, still in scrubs, exhausted. They say only a few quiet words, words that change your family's entire trajectory forever. And in that exact second, something inside you locks on permanently, not onto the drama of the moment, but onto the specific, terrifying weight of responsibility, being the one person in the room capable of intervening when nothing else can. You spend the rest of high school reorganizing your entire life around that single, distant possibility. You stack every advanced science class available. You spend weekends volunteering in a hospital doing nothing more grand than restocking supply carts. Because even at 16, you realize the cold truth. Medical schools don't care about passion. They care about documented pattern of unglamorous commitment, built over years rather than months. You enter university on a pre-med track, and the reality hits instantly. The competition is unlike anything you've ever seen. Organic chemistry alone wipes out a massive chunk of your incoming class in the very first year. Students who were used to being the smartest person in every room are suddenly surrounded only by people who were also the smartest person in every room. One by one, you watch your classmates quietly abandon the dream, not because they lack intelligence, but because they can't sustain the relentless, grinding consistency the path demands. You take the entrance exam after months of preparation that consume every single weekend and holiday. It's a single test that will largely dictate which medical schools will even look at your application. Your score comes back good enough to give you options, but not high enough to guarantee a thing. You enter a brutal application cycle, writing endless essays and sitting across from admissions committees who aren't just probing your transcripts. They are testing your capacity to sit with human suffering. Right? Because medical schools have learned over decades of hard data, raw intelligence without emotional resilience is a trap. It produces physicians who either burn out completely or grow cold toward the very people depending on them to stay alive. In your early 20s, the acceptance letter finally arrives. The first 2 years vanish into an overwhelming blur of sheer memorization. Endless hours in anatomy halls, learning the name, path, and function of every single structure in the human body. Then come the dissection labs. You stand over a body donated by someone who will never know your name, slowly realizing the profound weight of what you're looking at. This stranger's final act on earth was to become your teacher. It instills a quiet, solemn gratitude within you, one that will never fully fade for the rest of your career. Your third year brings clinical rotations, finally stepping into the hospital to treat real patients under supervision. You rotate through internal medicine, pediatrics, psychiatry, surgery, each discipline designed to test where your temperament actually belongs. Then, during your surgical rotation, you're permitted to observe a neurosurgery case. For the very first time, you stand quietly in the operating room, watching a surgeon work beneath the massive microscope on tissue so unimaginably delicate that a slip of a single millimeter could instantly erase a patient's ability to speak, to move, or to remember their own family. Your heart pounds in your ears the entire time, not out of fear, but from the overwhelming realization that this specific microscopic razor's edge is what has been quietly building inside you since you were 16 years old. In your final year, you apply for a neurosurgery residency. You quickly realize it is consistently ranked among the single most competitive specialties in all of medicine. With so few training positions nationwide, even exceptional students with outstanding records are routinely turned away. You spend a grueling application cycle traveling from interview to interview. You sit across from department chairs who have spent their entire lives inside operating rooms. Surgeons who aren't just reading your credentials, they are testing your composure with questions designed deliberately to unsettle you. because they know a fundamental truth of the trade. A surgeon who crumbles under the pressure of an interview will crumble under the pressure of an actual operating table. You match into a residency program. It's an achievement so statistically rare among your classmates that the moment the results drop, you feel less pure joy than a strange mix of relief and sudden dread. Because you understand immediately, matching isn't the finish line. It's the beginning of what is widely considered the longest, most physically punishing residency in all of modern medicine. The next 7 years consume your life almost entirely. Work weeks stretch far past the limits of any ordinary profession. Overnight calls come every third or fourth night, leaving you awake for 24 or 36 consecutive hours at a time. In that haze of exhaustion, you're expected to manage massive trauma cases, control brain hemorrhages, and somehow absorb a mountain of surgical knowledge that most people would take a lifetime to internalize. You are present in the operating room from your very first year, though initially you are only allowed to touch the absolute basics. You hold retractors, you suction blood from the surgical field, you stitch the incisions closed. After the real surgery is already finished, they sound like minor tasks, but they demand absolute, flawless precision. A poorly closed incision leads directly to infection. A retractor held even slightly out of angle can obscure a senior surgeon's view at the exact moment a life is on the line. In those long, grueling early years, you learn the fundamental truth of the craft. Neurosurgical training is an ancient apprenticeship. Skill and trust are never handed to you all at once. They are earned incrementally, millimeter by millimeter, case by case. You develop what colleagues in other specialties call, half-jokingly, a neurosurgeon's temperament, an ability to remain completely outwardly still while your own heart rate spikes during a critical moment, because a single trembling hand transmits directly through surgical instruments into tissue that cannot tolerate even the most microfraction of an unintended movement. You spend hundreds of hours outside the operating room deliberately training this steadiness, tying surgical knots over and over on scraps of suture until your hands can execute the motion without a shred of conscious thought, even when you've been awake for over 24 hours. Then comes the day you lead your very first craniotomy as a senior resident. The attending surgeon stands right beside you, but allows your hands to make the initial incision. The sheer weight of that moment settles into you permanently. The realization that you are now cutting into the tissue that protects everything a human being is. That realization will never fully leave you, no matter how many hundreds of procedures you perform. It simply becomes something you learn to carry alongside total technical focus, rather than something that paralyzes you. During your residency, you lose a patient for the very first time. It isn't through any error. It's a sudden, catastrophic hemorrhage that no amount of human skill could have stopped. Afterward, you sit alone in a cold hospital stairwell for a few brief minutes before standing up and walking back onto the unit, because the hospital does not pause for grief. You learn far earlier than most people ever have to how to compartmentalize devastating loss into a private, locked space, one you only dare to revisit later when you are completely alone. Meanwhile, your personal life erodes under a schedule that makes ordinary commitments impossible. Dinners, holidays, even sleep itself, all unpredictable. More than one relationship ends during those residency years, broken over a missed anniversary or a long-planned vacation cut short by an emergency pager. And you learn to grieve those personal losses in the exact same compartmentalized way, quietly and quickly, because no matter what broke inside your personal life last night, the next shift begins regardless. In your later residency years, you choose a subspecialty: aneurysms and brain hemorrhages, complex skull-based tumors, or delicate pediatric cases, each path demanding an additional fellowship beyond residency itself. Even after years of relentless work, you aren't finished. You spend another year or two narrowing your focus down to a level of rare expertise that only a fraction of surgeons worldwide will ever possess. You finally complete your training in your mid-30s, over a decade after you first stepped into a medical school classroom. You are officially granted the titles of attending For the very first time, you are permitted to operate without a senior surgeon standing directly behind you, ready to step in. And that first solo procedure without a safety net triggers a specific, singular fear, unlike anything you felt during training, because every decision made inside that operating room now belongs entirely to you. There is no one standing over your shoulder to catch a mistake before it becomes permanent. You build a career treating conditions most people never think about until they or someone they love receives the diagnosis. Brain tumors pressing against structures responsible for speech or movement, aneurysms that could rupture catastrophically without warning, spinal injuries that decide whether a human being will ever walk again. You learn to deliver these diagnoses in small consultation rooms, choosing your words with the exact same precision you bring to an operating table, because a family's entire understanding of their future depends on how clearly you explain a reality that even you cannot always predict with certainty. Then comes the day you perform your first awake craniotomy as an attending, a surgery where the patient is brought out of anesthesia during the operation. You ask them to speak, to move a hand, to name pictures on a card, using tiny electrical stimulation to map the exact invisible boundaries of their language and motor functions before cutting out a tumor, because human brains do not map out identically. Operating blindly near those boundaries risks taking away a person's speech or movement forever. And in that operating room, there is a particular, almost unbearable intimacy. Listening to a patient's voice answer your questions while your hands work mere centimeters from the very tissue responsible for that voice existing at all. Over the years, you develop an internal calculus that never fully leaves you, an ongoing, agonizing weighing of risk against benefit for every single patient. You come to understand a harsh reality of this field. There are no guarantees. Even a technically flawless operation can end in a complication that alters a human life permanently. You carry the weight of every outcome, the victories and the tragedies, in a private internal ledger that grows heavier with each passing year. It's a ledger you rarely discuss with anyone outside the small, quiet community of surgeons who truly understand what that responsibility costs. You lose patients over the course of your career, some through complications no surgeon on earth could have prevented, and occasionally through a decision you replay obsessively in the dark hours of the night, wondering if a different choice might have changed the outcome. And you learn that this specific kind of grief never fully resolves. It simply becomes something you carry quietly into every subsequent case, informing your caution, refining your judgment, without ever allowing it to paralyze your hands. You also save lives in ways that reshape entire families forever. You remove a tumor that would have been fatal within months. You clip an aneurysm just seconds before it ruptures. You relieve pressure on a spinal cord in time to preserve someone's ability to walk. Occasionally, years later, you receive letters describing weddings, birthdays, and graduations, milestones that exist only because you were steady enough on one specific afternoon years earlier. You keep a few of those letters in a drawer in your office, pulling them out to reread on the difficult days when the weight of the job threatens to become unbearable. Over time, your body ages under the relentless physical demands of the work. Your back and neck bear the accumulated strain of thousands of hours spent frozen in the exact same posture under an operating microscope. Many surgeons in your field eventually require their own procedures for the quiet physical toll this profession extracts from the very people dedicated to healing others. But then you mentor residents the way senior surgeons once mentored you. You stand behind a young surgeon's shoulder during their very first craniotomy. You fight the overwhelming urge to reach out and take the instrument from their hands, even when your instincts scream to step in, because you remember exactly how it felt to be trusted with that first incision. And you realize the ultimate truth of the craft. The only way this profession survives across generations is through surgeons willing to hand over control gradually, patiently, to hands not yet fully steady, just as control was once handed to yours. You are asked occasionally by a resident exhausted after an endless shift whether the sacrifice was actually worth it. The decade of lost youth, the broken relationships, the private weight of every complication you will carry to your grave. You pause, You consider the question far longer than they expect. You think about the patient who walked out of your operating room still able to recognize their own children. The aneurysm you clipped mere hours before it would have ruptured. The awake patient whose voice never once faltered while your hands worked centimeters from their soul. And you tell them the absolute truth. This profession will take more from you than almost any other career on earth. But very few human beings in any given generation are ever trusted with what you have been trusted to hold. And the weight of that trust, however heavy, is the entire reason it was worth every single hour it cost you. And somewhere right now, in a quiet hospital waiting room in a town nobody has ever heard of, a 16-year-old is sitting silently. They watch an exhausted surgeon walk out of the surgical suite, still in scrubs, delivering a few quiet words that change an entire family's trajectory forever. That teenager has no understanding yet of the decade of training ahead, the sleepless years, the personal and professional losses, or the unbearable intimacy of holding a living human brain in their own two hands. They have no idea what that moment is setting into motion, or what it will feel like after everything, to finally stand alone in an operating room for the very first time, with no one behind them to catch a mistake before it becomes permanent.